Perfect. Thank you, Debbie. Okay, so today we're going to start with some introductions to the CIRH team as we've had some new additions since we last gathered earlier this year. Sorry, not on the right screen. All right, and we'll provide a brief overview and review of the RCS2S and ERC programs. Then each team will share a bit more about the type of support they provide. Then we'll enter the bulk of today's training, which is a Smartsheet report submission walkthrough. We'll finish with about 20 minutes, hopefully more, of Q&A, and then we'll share a few announcements. So if you have any questions throughout the training, please either ask them in the chat and one of our team members will respond if they're able to, or you can wait until the Q&A portion to ask questions verbally live. Now we're going to go ahead and get started with our team introductions. So I'd like to introduce our leadership team. So Dr. Siddiq, could you start by introducing yourself and then just passing it along?
Sure. Thank you, Sarah. So good to see everybody, our school partners. My name is Siddiq, and I'm Executive Director of the Center for Immigrant Refugee Health at the Public Health Institute. And over to Kristen.
Hi, everyone. So great to see you all. I'm Kristen Burnett. I use she, her pronouns, and I'm the Deputy Director of the Center. And I'll pass it to Marta.
Buenos dias. Hello, everyone. Marta Induni. I'm the Division Director, which means I get to work with monitoring, evaluation, and reporting. So thank you. Nice to be here.
Thank you so much, Marta. And I'm now going to introduce our admin team. So Susan, if you'd like to go ahead and introduce yourself first, that'd be great.
Hi, I'm Susan Gluhanish, and I'm the program admin. And I'm going to pass it over to my colleague, Diana.
Hi, I'm Diana. I'm the administrative assistant.
Thank you, Diana and Susan. All right, next, I'd love for our refugee health support team to introduce themselves. I know Ezra is out today, so Jasmine, I'm going to pass it to you to start introducing your team.
Thank you. Hi, everyone. My name is Jasmine Kukan. I'm the Refugee Wellness Advisor with the Refugee Health Support Team. Pass it to Irina.
Thank you, Jasmine. And hello, everyone. My name is Irina Osacha. I am working on Ukrainian Refugee School and Public Health Educator. And I will pass it to Rafi.
Good morning, everyone. My name is Rafi. I work as a Refugee Health Navigator with Thera. Thank you.
Thank you, Rafi. And again, Ezra is not here today, but she's the project manager for the Refugee Health Support Team. And then we next have our monitoring, evaluation, and reporting team. Dr. Marta, I know you introduced yourself as leadership, so Dr. Marta is a division director for our MER team. And again, I'm Sarah Lackey, and I'm the advisory group associate here on the MER team. And now I'm going to let Debbie introduce herself.
Hi, everyone. Good morning. I'm Debbie De Sagoon. I'm the monitoring and evaluation associate with the MER team.
Hi, everyone. I'm Harshi Narola, and I am the research associate on this team.
Thank you so much, Harshi. And now I'd love to pass it back to Dr. Siddiq just to do a brief overview and review of the RCS2S and RC programs.
Thank you, Sarah. I will talk about the significance and what are the aims of the project, but I promise I'll be quick because I know some of you are already familiar because of the base RSI implementation, and also you have been on some of our presentation before. So the significance, why is this project even here? It is in response to the unprecedented refugee admission to the United States. Almost 500,000 people in only 2 years, while during COVID, the refugee admission was dropped to some 12,500, and prior to COVID, the refugee admission to US was about 20 to 25,000. That is from roughly 200 countries. But imagine in 2021 and 2022, 500,000 people admitted only from 2 countries. So that was a unprecedented. Yes, there was Vietnam War, conflict, crisis, and refugee admission, former Yugoslavia, a few other crises in the world. But this much refugee admission, the scale is unprecedented, and that's why these grants were appropriated by Congress. And when we talk about the refugee admission, on average, roughly 10% of the nationwide refugees are admitted to California. As you know, more than 10% of the US population is in California.
Oh, okay. I have that for you. You gotta.
Yeah, so so 10% of the refugees are admitted to California. And when we talk about the refugees from Afghanistan and Ukraine, roughly 50% of the refugees from Afghanistan are children, and from Ukraine, up to 90% are women and children. Obviously, why not men? Because men are, by law, they are supposed to stay in the country and engage in war with the Russian invasion for the case of Ukraine. And schools, when we talk about the schools, when I used to work on a SAMHSA grant, they were calling it the safety islands, especially in the context of refugees and immigrants. And the reason is that when we talk about young children, school-age children, refugees, they are out there in the community that they may not know the language, or they may be alien to the people that they are in contact with, or they might go home and their parents might be dealing with adjustment. You know, so the process of displacement is really taking a toll not only on children but the entire family, and also there is in some cases such a huge difference between the curriculum and the education system here in the U.S. and the countries of origin. In Ukraine to a large extent, but especially so in the case of Afghanistan. So some of the children that you are dealing with, that you have admitted to your schools, they may never been to a school because the literacy rate is so high in Afghanistan, and they may not know the language. So that's why it's a huge challenge, and that's why this project is so significant for this population. Next slide, please. So what do we want to achieve through this project? The main purpose is to support the academic performance and integration of these students, their siblings, and their families. I usually explain it to my colleagues that we're putting these children on a fast track. If you look at the highway, everybody else is on the highway, but we want to put these children on a fast track because they're so behind, and it's very hard for them to reach the academic success like everybody else if we deal with them like everybody else. And these funds are usually directed toward linguistically and culturally responsive support services. And because the refugee migration and displacement and integration is so traumatizing process, all of these activities are supposed to be trauma-informed and healing-informed for the families and for the children, but also preventing vicarious trauma and secondary trauma for the school staff, for teachers, for counselors, and everybody else that deal with these population. And as a general rule of thumb, these funds are considered or prioritized for communities that are underserved, hard to reach, and low income. And with that, I'll pass it back to Sarah.
Thank you so much, Dr. Sadiq. I'm now going to pass it over to Jasmine to talk more about the Refugee Health Support Team.
Thank you, Sarah. Yeah, so the Refugee Health Support Team is here to support you all as you navigate working with refugee families. We have some pretty amazing people on this team who are from the community and speak the languages of students that you're working with. The different types of support that we can offer include connection to different tools and resources. We actually have a web page where you can access tons of resources related to refugee children and families that we will share in the chat. Thank you, Irina. We also offer presentations and webinars from our own team and also from other experts in the field. And we offer individual consultations about any challenges that you might be facing in your work. We can also support with reviewing any documents or other types of content that's already been translated in Dari, Pashto, Ukrainian, and Russian. And I'm going to pass it to Irina to talk a bit more about our training and webinar schedule.
Yeah, thank you, Jasmine. And as Jasmine mentioned earlier, our commitment to serving the community is central in our mission. And to support this, so we're developing a list of training sessions and webinars designed to address key areas of needs. And we have already conducted webinars on essential topics such as basic needs support through the trauma-informed lens, culture competence about Afghan and Ukrainian refugee. Also, we will be hosting a webinar on Refugee Day on building bridges between refugee community in education, and we invite two students from high school, which shares a challenges and resilience story being a refugee student in US school. And we will have upcoming webinars about mental health and overall about health, child health, dental and care and well-being. And our aim is to equip you with the knowledge and tools necessary to better understand and support our community. And we're excited to share our upcoming webinar, which we will host on September 19, focusing on challenging in mental health, serving for Afghan refugee. And I believe we will share a link to register in this webinar so you can register and be added in your calendar. And again, we're excited to continue expand these opportunities, and we'll be happy to set up a session online or offline on culture competence or trauma-informed approach specific for your district. If you're interested in having this trainee for your school staff, for teachers, please let us know. And together we can serve our community effectively. And I'm going to pass it to admin team.
Hi, everyone. So as you know, you've all received a copy of your award. We require quarterly or semi-annual progress reports along with the invoices. And we've included the schedule here in the next slides, but they're due at the 15th of the month at the end of the last month of each quarter. So your first one will be due September, then followed by December, then March, then June. Payments are made according to the fixed price amount upon approval of the deliverables. This is a pretty straightforward invoicing process. These are some details what you're going to want to include on each invoice. You're going to want to include the CFDA number and the CFDA program title and your PHI agreement number, which is on the top right-hand corner of the first page of your agreement, which you've all received by now. So those are the elements of what you're going to include in your invoice, along with, for your September 15th, you'll include submission and approval of semi-annual report for year 2, quarter 1. So that's all included in your award. Next slide, please. So as I was just saying, submission of year 2, quarter 1, semi-annual report is what you'll include. Then you're going to want to include your invoice dollar amount. So if you recall from your contracts, the payments are broken down into 25% payments of each year's budget. So the first invoice will read 25% of the year 2 contract amount. So you'll include that amount in your invoice. We don't need the backup. That's for you to keep in case there's any audit that you can, prove out your expenses. We just need the one-page invoice that includes these details and that you're going to upload now. Some school districts started earlier, so they included it in an email, but now we're going through this new process, so you'll upload your invoice. And if you have both streams of funding, you will have 2 invoices. So they will be broken out because each one of your budgets are different. you'll have two different reports. So you will include two invoices, your RC and your ERC invoice. So there'll be two. So your award does contain this information, but if you have any questions, please reach out to us at refugeeschoolimpact@phi.org, and we're happy to help out. Next slide.
Thank you, Susan. Dr. Marta, do you mind going over this slide?
Glad to. Thank you. So here we've got some general information. And again, someone asked in the chat, but I'll remind folks we will be sharing the PowerPoint and recording, so you don't have to furiously take notes. We do have these different services that we're offering to help with the technical support pieces. Sarah leads the Communities of Practice Advisory Group, which also Irina mentioned earlier. We have these quarterly reports or quarterly meetings where we'll talk about special presentations and trainings to build capacity, also to exchange resources amongst each other and best practices that you're discovering. We will have office hours every month, and we encourage folks to be attend. I believe, although we hold them monthly, you know, we will record those and they will be available. You can expect some technical information, and if you're submitting reports or have questions about how to report certain data, definitely this is the place to come. We also have our own email, which is all about monitoring, evaluation, and reporting. You'll see this under technical assistance for reporting. And Debbie DeSagoon, who you've met earlier, that is her phone number, but your best choice is to email the team. So that way you've got several people looking for your email at cirhmer@phi.org. So we will have Zoom chats, and we'll also schedule virtual and in-person site visits, and we'll discuss that more as the year gets underway. Okay, next slide. All right, this is a lot of content, and we're gonna have this delineated. We do have some pretty impressive reporting requirements to our funder, and also they have it to their funder. So our funder is the Department of Social Services for the state, and they receive funding for this refugee support work through the Office of Refugee Resettlement. And so everyone's got different, or needs to report things as we move the data up to the ultimate funder, which is ORR. We're going to be asking you, and we've tried to really make this as easy as possible because we understand that you all already have a lot of reporting to do and are already mired in documentation for regular school duties. So we're going to ask you to provide us information around any outreach activities you do in terms of recruiting participants for the program. We're going to ask you about sociodemographic information, and I'll put a little asterisk there because we're going to talk more about that in a moment. A lot of the reporting is really around what type of support did you administer, and also the frequency of those services provided. And so hopefully those aggregated counts won't be too burdensome as far as the quarterly and semi-annual reporting. We will help with follow-ups if we see something that looks a little bit like a challenge in the data, or if we're unclear about something, we will follow up with each program to make sure we're all working at our best capacity. And also, again, when you participate in those communities of practice groups, you may hear of. Those best practices, but also areas of improvement, get some ideas for improving either participation or documenting services. And also we will collect success stories because, as you know, it's those stories that really move the needle on what gets attention and also on really raising up the success of a program. So every month we're going to ask for some sort of communication, and that sounds like a lot, but really this is either participating in those communities of practice groups, getting some technical assistance, maybe an email correspondence, just something so that we have contact every month with each program. That way we know you're engaged, and we can also be supporting you in the way you need to be supported. We will have monthly cohort meetings. Again, this is all information. It's bi-directional, so we'll provide some information, but we'd also love to hear some information. And one final responsibility, as you know, when you're talking about reporting to funders, really need to track all expenses, document all expenses associated with the funding, and making sure they are in alignment with your budget and work plan that were approved. All right, and again, the goal is to make things as easy as possible. So basically every 3 months, there's going to be some sort of report due. We're going to have your first report be a semi-annual report, which is counterintuitive, but it's based on how we receive our funding, because even before you're all doing a big startup, we've been doing a startup for over a year to get these things in place. So we're actually a little bit off with our funder year. So we're going to ask for a semi-annual progress report. As Susan mentioned, this is going to be due in September. September 15th is the date. And we're calling this the long report. Of course, many of you will not have a lot of things to report, right? And that's fine. We're calling it a long report because it has more sections than the quarterly report. We're going to ask for counts, as I mentioned, frequencies, but also some qualitative data around information from your participants, if they're getting what they need in terms of services. Consider it more of an evaluation or assessment, and you will provide that every 6 months. We are actually providing these reports as forms online. So essentially, just fill out the form. Now, we will also have templates available for you so you can see what the form is going to require. All right, I see September 15th is a Sunday in the chat. We will adjust, and I'm going to make an executive decision that we'll accept those on the 16th, and I'll take the heat from my team. So thank you for that. The quarterly report is a little less intense, only asking for quantitative data. And again, we will provide you with a form where you enter the data, and then the template so you can see what will be expected as far as that form goes. I hope that makes sense. Okay. Don't let all of this alarm you. This is basically meant to be really clear about the reports, which style, the semi-annual or quarterly, the reporting period they cover, and then the dates that they are due. This is really informational, and just to help everyone keep their goals in mind, and for us also to keep the reporting periods in mind. So thank you for that. And then this one is pretty self-explanatory. When you do submit those quarterly and semi-annual reports, you will also be submitting your invoices. There's going to be a space on that form at the end to upload your invoices, and we will review those and send it to the fiscal and admin team to initiate payment for those invoices. So I hope that makes sense. Also, as Susan mentioned, we're just looking at the invoices that request 25% of your yearly budgeted amount. All right, go ahead. Okay, this is just highlighting the first one will be due September 16th now. We will be here to support you with those. Like I said, you're probably not going to have a lot of data to feed into those unless you've been underway for a few months. Yeah, so I think that's my last slide for now. Yes. Oh, wait, 20. This is slide 20. This is mine too. Okay, when I mentioned the form, it's actually, we've created it in Smartsheet, something you may not necessarily notice because you're really just going to get a form that you fill in. We're going to have instructions everywhere. We're going to have templates everywhere. And we're also, on those semi-annual reports, I want to mention that the qualitative data, I alluded to this sort of participant assessment questionnaire. How are folks doing? What services are challenges? What can get improved? This is also required by the ultimate funder. So just to let you know, this is not something we're initiating, but something that eventually gets reported to CDSS and then to ORR. Another document that we're going to ask you to maintain is this individual level data document. This is, as it sounds, it's participant information. So you've got a student that you're enrolling in this program. You're going to collect certain sociodemographic information about them, and we're going to have some guidelines to administer, best practices around confidentiality and data security. You're going to keep those on site. We don't want you to share that with us. The only exception to that is if we're asked to do an audit by either CDSS or from ORR, we may need to take a look at those, at your demographic information for the individuals. One thing is that we're more than glad to do technical support with that. And when we do either the virtual or on-site visits, we will also be looking at the individual level data document, which we will provide you with the form, the document form, the fields that you need to collect. And yeah, again, any suggestions for making things easier? We recognize this is a lot of reporting, and I think we've done a fairly good job of anticipating the challenges and trying to resolve those before we get into the field with those. So, all right. I hope that was good.
I'll take it from here, Dr. Marta.
Thank you, Debbie. Appreciate it.
Yeah, and we could say on that intro slide to the Smartsheet training. Hi, everyone. Again, I'm Debbie DeSagoon. I'm the Monitoring and Evaluation Associate with the Monitoring, Evaluation, and Reporting team, and happy to meet you all for the first time virtually today. So I'll go ahead. I'm going to go lead the walkthrough training of the progress report submission process through the new online portal, which is called Smartsheet. And we're really hoping that this process supports all of the grantees' efforts for fulfilling your reporting requirements for the RC award. Oh, yes, Dr. Marta?
Sorry, Debbie. A couple folks are reporting that it's hard to hear you.
Okay.
So I don't know if you could talk a little bit louder or get a little closer.
Okay, I'll try to get a little closer. Is that better? Oh, it is. Okay. Oh, it makes a difference. Okay. Okay, so I acknowledge there's going to be a lot of information and instructions I'll be throwing at you. So I wanted to just give you this quick overview. The first two highlighted blue items here That's where I'll be devoting most of my time. There are some dense instructions on the first couple pages of the homepage, and I'll go through those slowly with you all. And then I'll show some snapshots of the major sections of the progress submission portal. I won't go through each and every question, but just a snapshot of the sections so that you have a taste and flavor for how the report link is. And then what Dr. Marta shared will introduce to you the participant assessment form, as well as the individual level data collection. For the September 15th report due date, the last two here will not be due, but we wanted to go ahead and introduce them to you. So further guidance and instructions will be given at a separate time for that. Okay, next slide. Okay, is the volume better? I can scoot a little bit better and it looks like my volume is up.
It's better, Debbie.
Okay,
Thanks.
great. Okay. The link to the Smartsheet progress report submission portal will be provided shortly after today's training. So for the purpose of today's mini training walkthrough, I'll be giving snapshots and you'll see exactly how it will look like on the Smartsheet portal. So a couple of Smartsheet basics. So again, Smartsheet, it's an online portal and it's accessible through a link year round. You won't need a password or login. Once you click on the link, you'll see 2 pages on the home page. And then after 3 clicks, you'll see all the questions that you will that are required to be completed for either a semi-annual or a quarterly report. So it's quick and easy to access with a click of a link. And again, we will provide that link and the PowerPoint slides for this training along with the recording afterwards. Okay, and wanted to assure you all this won't be the last time you'll hear, or the first and last time you'll hear about Smartsheet. So we have guidance tools, including the training recording from today. As Sarah and Dr. Marta shared, we'll be hosting monthly office hours. You're always welcome to email, give us a call if you need any live assistance while completing the report. And then in a few slides later, I'll go over the 4 online progress report planning and preparation forms which we developed. You don't need to submit these. These are just for you and your team's assistants to help you keep on track for the progress report submission due date. And next slide. This is just the same slide that Dr. Marta had already introduced. Again, there's going to be a semi-annual report and a quarterly progress report. Just a note that there are going to be 2 Smartsheet links for the semi-annual one, and then 1 link for the quarterly progress report. You don't need to memorize this, the weeks and the months.
All of this, what I think our admin support is going to do.
So you won't need to, again, memorize any of this. The weeks and the months before any report is due, we will be sending emails and reminders of the due dates, and also it'll be very clear which links need to be completed and submitted to us. Next slide. Okay. So once someone clicks on the link, they'll see the home page here, and there is a scroll bar. So you'll see 2 pages. I know it's very tiny to see, but I'm going to zoom in on each of these sections in the next few slides, but I wanted to give you a preview what that homepage looks like. And then on the next slide, you'll see if you scroll down, so these are the 2 main pages that you'll see. There's an introduction. Those are the 4 online form links that are downloadable for assistance. Again, those are not to be submitted. They're just for you for support and guidance. There's a reminder there, and then the instructions on 3 clicks to start. On that second page, for those of you who already have active executed contracts, this looks very familiar from the PDFs that you used to fill out and send through email. This is going to be all completed and and typed in into Smartsheet instead. So a few of the fields there, very general information. It's the school district name, the accounting, invoice, personnel. Definitely want to know any of the break dates and who we should contact during those break dates. Okay, and then next slide. Okay, so I'm going to go through each of these 4 sections very slowly. So on the next slide, for introduction, again, this progress report is designed to capture how the RC program has really impacted school districts, youth, and families for the current reporting period. And you'll see that the reporting period in bold, we've already pre-populated that in anticipation for the September 15th due date. So that will always be clear of which reporting period a progress report due date will be for. And Dr. Marta also alluded this already. Our results will be aggregated anonymously, and we deliver these aggregate results to our funder, to the California Department of Social Services. So that's it just for the introduction box. Okay, and then we'll go to the assistance section, which has those links. So next slide. Okay, so again, these are clickable, and once you click on them, you'll be able to download these online tools. Again, they are not to be submitted to us. This is just for further assistance. So I'm going to actually show you screenshots of each of these forms and share the purpose. I'm not going to go through each of the pages of them, just a snapshot of each of those forms so you get a flavor of them. So on the next slide, you'll see Form 1, and this is called the Semi-Annual Progress Report Template. This document includes all the questions that will be required to be completed on Smartsheet. You can consider this as like the hard copy version of what you need to complete on the Smartsheet portal. So you're welcome to download this and print it out, place it in a binder, or keep a virtual copy. But really, this is to supplement any of your other data reporting tracking systems that you have in place, but this gives you a copy of all the questions so that you're not surprised on the progress report submission and a due date. So this applies to both RC and NERC. Again, this does not need to be submitted to us because all the questions will already be embedded into the Smartsheet portal link. And then for Form 2 on the next slide, this is the quarterly progress report template. So it's the same concept. It includes all the questions that you will need to complete on the Smartsheet portal. And the questions are actually a subset of the semi-annual report. And then Form 3, this is like a mini glossary, and it has a copy of the progress report due dates that Dr. Marta showed earlier. So if you have any questions or you need clarifications on some of the terms that are on the reporting platform, this is a good reference document for that. Or if you want to go ahead and print that 1-pager of the progress report due dates, you can find it on Form 3. Okay, and then the last form, Form 4, is a checklist. Again, this is not, it doesn't need to be submitted to us. If you're like me, I really appreciate checklists, especially it's my first time submitting a report on this new platform. I just want to make sure all of my bases are covered. This is it's around a 10-step checklist just to make sure that you and your staff, as your first time submitting through this portal, that you're completing all the steps. So on the next slide, I'm going to zoom back out because that was a lot of information. So we went through the introduction. We went through the online assistance forms, and then I'll go over the reminder right now on the next slide. Okay. So logistically, all the required information, it has to be entered in one sitting for the progress report submission to successfully go through. So this means that your responses, they are not saved until you hit submit. So we really advise you all to have all the required information using the templates, Form 1 and 2 that I described. So, and stable internet to prevent any disruptions in the submission process. So you can't type in some information and then leave it in your computer because it's not going to save that way. It needs to be done in one sitting. And then overall, Dr. Marta had shared this also. Please note that most of the responses that you are completing on the Smartsheet portal, they're mostly numbers. So you're typing in a lot of numbers. And then there's going to be some open text questions as well. And there'll just be a few questions where you do need to download a PDF, complete it, and re-upload it. And I'll go through that with you. Okay. We've done introduction, the forms, the logistical reminder, and then I'm going to go over the 3 clicks to start from this homepage. So on the next slide, you'll see this is exactly how it will look like on the portal. You will choose semi-annual or quarterly. So for purposes of the upcoming September 15, 2024 due date, I press the top radio button and you will do so as well. And then you're going to choose which funds your school district is receiving. So for purposes of today's training, I've just chosen RC. If you are a school district that has both awards, you will need to complete an entire report submission for each of those programs. So 1 report submission for RC and 1 report submission for RC. And then there'll just be 1 option here, and I've already pre-populated and chosen it. So step 3 is just to choose the reporting period, and you'll see the due date there for September 15th, and the reporting period is April 1, 2024 to September 30, 2024. And as we have shared, since this is the first semi-annual report, there's not going to be a lot of information, but we still ask you to complete it as best as you can. So once those 3 things are clicked off and checked, then all the questions that you will need to complete for the semi-annual report will appear. So you'll see the scroll bar, and you'll see all the questions that you'll need to complete in that one sitting before you click submit. Okay, next slide. This is a table of contents that you will see for the semi-annual progress report, and it's lettered A to H. And I'm going to transition now and showing you how some of the questions look like. So there's a lot here, but I'm not going to go through each of the questions, but I'll go through each of the sections so you have a glance and a feel of how the portal looks like. So A, we have a quick question on program staff. So we want to know about any staff changes, new hirees, and this is an open text box. And for section A, it's really just that. This is actually the full section A. It's just 1 question. And then next slide for section B. And this is actually also the entire of section B. So we're asking about accomplishments, challenges, learnings, lessons. Also, for those of you who have already completed some quarterly progress reports already, you're familiar with the activity frequency table. So you'll see the first 2 questions of section B are open text, and then 3 and 4 will be PDFs, form 5 and 6, that you will download, complete, and then upload into section H, which is titled PDF forms and invoice uploads. And I'll go through that when we get to section H. But yeah, that's the entirety of section B. And then section C, also this is the entire of section C. It is an open text question. As part of the grantee's contract requirements, we would like to know the process, because we have to report this back to our funder, the process for determining eligibility verification for the program, and how do you manage documentation records. And if we can take, I'm just going to take a couple steps back. Sarah, if you can click on back to the overview, the table of contents. Okay, great. So you'll see here that some sections are highlighted in blue, and there's 2 sections, F and G, that are highlighted in red. I just wanted to note that the items that are highlighted in blue are data that you are entering for the reporting period, which is April 1, 2024 to September 30, 2024. There are 2 sections here where you are reporting data for the federal fiscal year, which is October 1, 2023 to September 30, 2024, for F and G. And it's just this way because it's the way that we have to report back to our funders, CBSS, and it's the way that they also have to report back to the Fed. So I just wanted to make that distinction. That's why those two sections are in red, and we'll go through those slowly as well. So we can fast forward back to see, we did that. That's about during the reporting period. And then next slide. I'm gonna skip section D because I've scooted that over closer to the end about individual level data collection. So I'll skip that for now. Okay, section E is about meetings attended during this reporting period. So we want to know how many PHI SERA-led cohort meetings that you've attended, and it's organized by the different category of the meetings and the trainings or conferences that we lead. If you are a school district that has both an RC and an ERC award, you only need to complete this once because those meetings count for both of your awards. And for section E, this is the entire section E. This is the full snapshot of it. Okay, next slide. So section F is a bit longer, so these are snapshots. And for this section, we're asking about program participation by service activity, demographics, and other characteristics during the federal fiscal year. So this is the section that refers to the federal fiscal year, October 1, 2023 to September 30, 2024. And in this section, if you are providing all of the 5 types of service activity categories, you would click on all of these. If you're providing 2 out of 3, then you would click on which ones are the respective categories of services that you've been awarded and been asked to implement. On the next slide, it'll show, so actually let me take a couple, so this is the first section where the term non-duplicated participant appears, and we just wanted to level set everyone's definition for this. And it's a participant who has received services, activities, and counted only once, regardless of how many times they access these services, activities per service provider. And yes, more than one person can be on Smartsheet at a time. There's no login or password. So I could be on it, a school district, and another school district can be on it, and another person from your team.
But I don't believe that more than one person you can't kind of collaborate on the form at the same time.
Not at the same time.
One person would have to be submitting the form at once, which is why we share the templates in case you need, because I know sometimes you need information from different individuals, which is why we have the templates provided, since you won't be able to collaborate at the same time on the form.
Oh, yeah. Thanks for that clarification. Okay. On the next slide, it shows what happens to, say, for example, in a scenario where a school district provides 2 types of service activity categories. So say they offer basic needs support and family engagement and empowerment. They would click those first 2. And once they click those options, these 2 boxes pop up for each of those categories. So for connection for basic needs support, each of these categories, we will ask the number of non-duplicated student participants and family members that were served for that specific category. So if you're awarded to just provide one type of category, then only one box will show, versus if you provide all 5 types of these service activity categories, all the 5 boxes will show. Okay, and then next slide. This is another, so section F is very, very long. I just wanted to give you another kind of glance of a different type of question. So for federal fiscal year, how many non-duplicated participants in the program? Described in section B, what were their gender identities by these categories. So section F is, I want to say, the longest section, but just wanted to give you an idea. You're putting in a lot of numbers into these fields. And section G, so we're almost at the end. We have one more section after this, so bear with me, and we'll go through questions. So this is program participation total, and it's in red, so this means during the federal fiscal year. So we want to know the total for the federal fiscal year for the number of non-duplicated OR eligible students as well as OR eligible adults who participated. And then the last section H, this is the section where I mentioned where you would upload required PDF attachments that were asked of you in other sections. And this is where you would also, of course, upload your invoice. I wanted to note that all of the questions are required, including the upload. So if you miss a question and you click on submit at the end, a red pop-up window will direct you where you need to go back and fill in those answers. So after you upload them, we have just a reminder attestation box here. Check this box once the PDF forms are uploaded, and then check this box again, or this second one, once the invoice is uploaded. And then after section H, you will see the submit button. So the only way that it successfully goes through is that all the questions are completed, the attachments are there, you've attested that you've attached them, and then you click submit, and then you will receive a message you've successfully completed this progress report submission. If, again, you are a school district who has both awards and you just completed this one for RC, you would click the link again and start one over for your RC award. Okay, and the next slide. So this is just an introduction. It's not going to be due for the September 15th, 2024 due date, but we just wanted to, again, these are screenshots of the semi-annual participant assessment questionnaire that we've developed, and it's going to be a self-reported questionnaire that we hope that you will distribute to your program participants so that we, SURA and the grantees can together really assess from the participants' point of view, like the impact the program has had on them. And then we will have this questionnaire, it'll be translated in Dari, Pashto, Ukrainian, and Russian. So those are just so there'll be more guidance on this, but just wanted to introduce the concept here. And then I'm gonna hand over the mic back to Dr. Marta briefly.
Hi all, thank you, Debbie. I know that's a lot of incoming information, and again, we will be glad to support you on all those sections, but I think Debbie, looking at the lack of questions in the chat, I think we're doing pretty good here in explaining what's coming up. So the individual level data, again, it's participant data. This is going to include some very sensitive information around names, gender, alien number, all these, personally identifying information that we really want to keep private. I know that schools and districts are very used to handling this type of data, and we absolutely rely on your ability to keep this confidential. We're going to provide you with a formatted document. I mentioned it's going to be an Excel sheet with columns, and each row will be a different participant, and you're going to keep that password protected file in a secure place. It's going to be stored locally, meaning on your computer, and we emphasize not sharing it with anyone except if our program asks you for it. So the Center for Immigrant and Refugee Health is subject to audits, data audits. If we are asked by the state or by the Office of Refugee Resettlement, we may be in touch with you around looking at your data file for the participants, for the individual level data. Of course, when we do site visits, either virtual or in person, we're also going to take a look. And although it's not anticipated, maybe subject to ad hoc reviews, but that's really only to be helpful and to see how maybe we can facilitate the data gathering. Yeah, I think that's good for this slide. And then Debbie, now that you've taken a breath, back to you.
Yeah, thank you. This was a section that I had skipped over. It was just better covered here because it relates to the individual level data attestation. Good news is for section D, it's just this one check mark attesting that your school district is securely collecting and storing those individual data as Dr. Marta described, for the program. And just a reminder to follow those security standards and using the template for these governance requirements. So that's all of section D. And I'm so sorry that some of you can't hear me again. Hopefully the recording is louder, and I'm happy to chat with you guys one-on-one on telephone call. I promise I'm very loud on my telephone. And Zoom, I'm on a new system today, so I apologize for that. So I want to let you extend that opportunity. Our email is here. My telephone number is on the slide as well. I promise I'm very loud there. And if you have any follow-up questions with your team, happy to go through these again. With you, we're here to support you, especially with the September 15th. I know it's coming close.
Thank you so much, Debbie. All right, I would now like to, we have about 30 minutes left, so we were ahead of schedule. Good job, team. We have about 30 minutes for any questions. So if you have any questions, please type them in the chat, or if you'd like to ask them verbally, you can raise your hand, or if no one's speaking, just go ahead and share. I'm going to stop sharing my screen, but I'll be ready to share the slides again if you have a specific question on the slides.
Hi, Debbie. This is Sandra Candler-Wafer with Cajon Valley. I just had a question back on the individual data collection. Did I understand you correctly that it should be stored on like somebody's computer? Because I know all of ours is stored on our server, so we don't really keep anything on our little individual laptops. So would it be still okay to store it there, password protected? I just wanted to get some clarity on that.
Yeah, thank you for that question. When I say locally, I mean under your control. So if there's a section on your servers, on your network that you control, that's where it should be placed. And then just to emphasize, it's going to be password protected. So even if someone else in the network comes across it, they will be unable to open it without that password. Thank you for that question, Sandra.
Great, thank you.
Can I ask a question about the wellness conference scheduled for October?
Yes.
Can you tell us a little bit about like what the expectation is from districts? Because for us it would be we'd have to come a long distance versus those of you guys up north.
No, thank you so much, Anita, for asking about that. And hopefully I sent out the invitations this week, so hopefully at least one person from your team received those. If you didn't, please let me know and I'll figure out what happened. But yes, the conference is a one-day in-person event October 25th. It's at UC Davis, so just outside of Sacramento. And Dr. Siddiq or Dr. Marta, please feel free to add anything that I might miss, but we are strongly encouraging attendance from all of you. I know that for those of you that are in Southern California, it is a bit more of a hike than it is for those of you that are in Sacramento or even the Bay Area. But you will be able to, use some of your RCS2S or ERC funds to support the travel costs. But again, we'd love for at least one or two representatives from each district to be there. but we, again, understand that there might be challenges in getting there. But Dr. City, would you like to add anything, add any clarification?
No, I think you explained it very well. So Anita, the purpose of the conference is that to create an environment or bring schools, CBOs, and other partners together. Through the ARSI and URSI, it is one grant that we are working with. Excuse me, but there are other grants that we are working with the same population as well. For example, mental health and also CBOs, the social services. So all the schools coming and attending, they will have an opportunity to connect with other partners in the community. For example, if you're in LA, you will learn who is the service provider that provides mental health services and who is a CBO that works with domestic violence, social services, basic needs, and stuff like that. So I think it's an opportunity to connect with other CBOs and county and state officials and learn best practices from others. And in a nutshell, the expectation is for you to come and, with the COVID and everything virtual, there are not a lot of opportunities that we see in person. So I hope that conference provide that. And it's just one day. But as Sarah said, I understand it's a little bit challenging for those who are traveling from SoCal. So, and we appreciate your participation.
Can I ask a question?
Yes, please.
Yes, hi. Thank you so much for all the presentation. Regarding the conference, I would like to know if it's the setting is just like other conferences that you have a speaker and stuff, or you ask for speaker, you call for paper, or how is that? Is there any possibility for our district to send a speaker or to prepare some information about our activities, our program for refugee, or it just informative conference that we attend and we learn about those possibilities? Thank you. Ina.
Thank you. That's a great question. We will be having some speakers, and we're finalizing our agenda, so we'll share more information about that on our webpage and via email with updates once that's finalized. And we are working on finalizing some ways that you all as school districts and CBOs can be involved and highlight some of the work that you're doing, even if it's not through presentation, but through modeling some of your work to have at the event to support with conversations. So we are finalizing that. So I'll share updates around that next week. And if you are really eager to participate in a specific way, you can reach out to us at refugeeschoolimpact@phi.org, and I'll also put my email in here directly too, if you'd like to reach out to me directly if you have specific ideas. And we might not be able to accommodate all of those this time, but we are wanting to plan future events, so we can definitely discuss that in the future if we're not able to accommodate all of that for this event, given that we're a little bit closer to that and have almost finalized the agenda. Does that help?
Yes, it was. And
great.
Can I add a bit to that also, Sarah? We will have an opportunity to do posters, and we're going to solicit those shortly. So if you're doing something that's particularly exciting, whether it's research or an art project or whatever, we're going to have an opportunity for participation from each awardee. So more information to come on that. And to answer a little piece of your earlier question also, it is in a conference center. So it's going to be in big rooms with lots of people. I think it's shaping up really nicely. Sarah's taking the lead on organizing that. And I know we're going to have some amazing speakers. It's going to be uplifting, and it's also going to have some really good food. So we know that always helps.
Yes, it does. Thank you.
I have another question this time about the reporting. Can you just asking for clarity? So is the reporting that we're doing for our, and Glendale, we get ERC, so I'll talk about the URSI. Is it meant to only report activities that are conducted for our students and families using ERC funds, or can it be like the stuff that's interwoven that we do with like our URSI stuff, our community grant, or community schools? Is it just URSI funded stuff or the interwoven stuff?
I'll grab that one. Thank you. That's a great question. And we know there's a lot of overlap with existing funding and existing activities. So the counts and the frequencies and all that is really specific to the participants benefiting from this funding. However, if you've got a program that you're doing that is open to other students, or that is funded in a different way, we would love to hear about that. In some of the qualitative answers will allow for more speaking to that. But in terms of the counts and frequencies, as you know, we asked everyone what your how many participants you're anticipating, and even though that was a guess, we do want to make sure we're tracking with you on those things. So that's why we're asking for those counts. Yeah, but we recognize you're doing other important and meaningful work through other funding also.
Hi, I'd just like to piggyback off of that. I know the RSI program has a lot of overlap, but the these supplemental programs, ARSI, S2S, and URSI, are distinct, and it's very important to report the students and family members served by these two supplemental programs separately from RSI. So any reporting you're doing for the base RSI program should not include these students and their family members. They are distinct. So that is one thing to keep in mind.
Any other questions about the conference, reporting, or just any other questions for our team? Great. All right. I am going to, we have one last slide just with some upcoming meetings and announcements. So I'm going to go ahead and start sharing my screen to share those and wrap up. So if you have any questions, just please feel free to cut me off or ask in the chat. But I'm going to go ahead and start sharing my screen again to go over the last slide. Okay, great. So yeah, thank you all again for your attendance today and engagement in the training. There are just, a few announcements before we wrap up today. There was a lot of information shared, especially around reporting. So we wanted to let you know that we'll be hosting an office hours next Thursday. No, I'm sorry. It's next Tuesday. Next Tuesday, August 27th. I'll fix that on the slide. From 3 to 4 p.m. Pacific time, we'll be sending that invitation link out today or tomorrow. And this will be a space for anyone who's not able to attend today's meeting, and or for folks to convene and ask more questions about the upcoming semi-annual report that's due September 16th, and the report submission process via Smartsheet. And again, this is Tuesday, August 27th. I'm used to having meetings with you on Thursday. Go ahead, Stephanie.
Hi, everyone. So just for clarification purposes, the tools and everything that we submit, I just want to make sure I'm not missing anything. Has that been provided to us, or are we still waiting for that?
No, we'll be sharing the link. Debbie, when would we be sharing the link?
We'll definitely be sharing the recording and the PowerPoint slides from today, probably today or latest tomorrow. We might just be making some polishing tweaks to the report link, so that just maybe Monday the latest, hopefully.
Okay, so Monday the latest for the link, so that we could add all the information and that's required and asked of us, correct? By Monday? Okay, got it. Thank you. Thank you so much.
All right, I updated it, so now it's accurate. Tuesday, August 27th. And again, we will be sharing those resources soon, as I know that it is a lot of information and we want to give you all enough time to work on that. And we will have the office hours next week, and then we'll begin having monthly office hours. And the 2024 office hours schedule will be shared ideally by the end of this month so that you all can add those to your calendars. And again, our communities of practice advisory group meetings will be quarterly. In the past, they've been monthly, but given that we do have a lot more meetings that we're hosting, we're going to have them quarterly so we're not overwhelming you all with seeing us too much every month. And we did talk briefly about the in-person conference, which as a reminder is Friday, October 25th at UC Davis, the ARC Conference Center. And invitation emails were sent earlier this week. So if someone from your team did not receive that, please don't hesitate to reach out to me and we'll troubleshoot that. And we will be, someone from our team will be reaching out to each of you individually to schedule site visits soon, as we'd like to schedule those between now and December. So please be on the lookout for email from one of our team members to coordinate scheduling site visits. But that is all that we have. Great, thank you, Janice. I will make sure that someone from your team received it, and if not, I'll make a note to send that to you as well. All right, but I'm going to stop sharing my screen, and as a reminder, we'll be sharing the slide deck and the recording with you all probably by tomorrow, if not earlier. And we'll be sharing the office hours information as well for next week. So if you have additional questions, you can see us then and ask any questions that you have. And you can always email us as well. We're eager to support, and yeah, really appreciate you all taking the time out of your busy schedules to be here today, and hope you enjoy the extra 15 minutes that you got, and hope everyone has a good rest of your week and weekend.
Thank you.
Thanks, everybody.
Great to see everyone. Thank you.
Thank you so much. Appreciate today.
Thanks.